Good afternoon, it's Thursday, October 1. I'm Herman Green with your midday news. If you're watching online at onespotmedia.com, a very special welcome to you. Thanks for joining us. Health Minister Dr. Christopher Tufton has announced that the COVID response will be improved to include a mental health component which targets vulnerable groups, particularly the elderly. He was speaking at the weekly COVID update press conference yesterday, where he expressed concerns about loneliness, post-traumatic stress disorder, and other mental health issues affecting senior citizens as a result of the stay-at-home orders to protect them from contracting the respiratory illness. Addressing the press conference, senior citizen expert Professor Eldemira Shearer pointed to physical issues which she says is also affecting the elderly. She quoted statistics from recent surveys.
Many of our houses, both in all of the socioeconomic groupings, many of them no longer have gardens and yards, even townhouse complex. And the issue of sitting in a chair or lying in a bed for 7 months is beginning to take its toll. When we looked at the data we got from both surveys, only 40% of our seniors lived with a spouse. So we have 60% that are living either alone, 30% did live alone, 30% lived with somebody else. Significant because at the beginning of this, in one of your first town halls, we all spoke about the need for family and the need for people to support each other. Some of these spouses are themselves quite old, and then you have the 30% living alone.
Meanwhile, an additional 4 persons died from COVID-19 yesterday, increasing the death toll to 111. In its latest bulletin, the Ministry of Health said the deaths comprised of 2 women from St. Catherine, ages 70 and 74. The other 2 include a 75-year-old man who lived in St. Elizabeth and a 69-year-old Westmoreland man. Meanwhile, the country's coronavirus case count now stands at 6,555. 73 new cases of the coronavirus were recorded yesterday. A breakdown of the ministry's latest figures indicated that Kingston and St. Andrew and St. James recorded the most new cases. Kingston and St. Andrew recorded 40 new cases, and St. James had 13 new cases. Now, with the number of COVID-19 cases constantly increasing, the Southern Regional Health Authority is promising to increase its response and preventative measures. Case count at the regional hospitals have already consumed 50% of the healthcare resources.
With the island recording a daily increase in COVID-19 numbers, greater focus is being placed on personal care to reduce the spread of the respiratory virus, especially with community spread now rampant. The Southern Regional Health Authority, the SRHA, which is responsible for Manchester, St. Elizabeth and Clarendon, says no effort will be spared in getting it under control. The commitment was made at Wednesday's COVID press briefing in Manchester. Now, based on figures since March, the 3 parishes have recorded combined figures of over 800 COVID cases.
When we look at Manchester, we're seeing the cases scattered all over the parish with a high concentration within the central area around the Mandeville and around that area, but no area is spared in terms of the distribution. And also with St. Elizabeth, which is in the yellow, we can see the distribution all over the parish and as well as Clarendon. So with the community spread, we're seeing the movement in terms of expansion of cases all over the parishes.
The region also recorded 9 deaths since the virus entered our shores.
For Manchester, we have 9 cases, and when we look at the cases in terms of the age distribution, we see that the deaths are occurring mainly have a higher percentage within the elderly. So for example, the case fatality within, say, under 10 years old would be 0.4, but if we look at the 90 and over, what we're seeing, 24.1% of those cases lead to death. So what we're seeing is that within the elderly, the fatality rate is much higher than the other population.
In the meantime, the Health Ministry has disclosed that half of the beds designated for use by COVID-19 patients are now occupied across the 3 parishes.
In terms of the COVID beds, for Manchester, that has 22 beds, 10 beds are now occupied. And for Maypen, that has 26 beds, 22 beds are occupied. For Black River, 23 beds, 5 beds are occupied. Percy Junior, 16 beds, 7 beds are occupied. Lionel Town, 11 bed, 5. So about 50% of all our COVID beds are being occupied.
Shane Masters, TVJ News.
To other news now. A freak storm last night did extensive damage to the roof of the spectators' stand at the Addison Park Sports Complex in Brownstown, St. Anne. Shortly after 11 p.m., heavy winds ripped through the large covering, separating it from the structure's pillars and tossing it to the ground. The roof was completed last year at a cost of $1.5 million. Kim Brown Lawrence is the counselor for the Brownstown Division.
This was a commitment from the heart to the people of Brownstown. They asked for it for years. And to come and see it like this morning, I am a bit distraught, but the work will be done. I'm a woman of my words, and as you can see, we already started working back. We have been here since after 5, and they started working within that time region.
Residents in the area showed our news team several other roofs, fruit trees, and motor vehicles that were damaged in the incident. One resident says the situation could have been worse if it wasn't for the imposition of the curfew hours due to COVID.
Yeah, man, a lot of things going last night. If it wasn't curfew, maybe a lot of people would be blown away. Yeah, man, the wind was so terrible. Anything come from the east, you can't play with it in these times, you know. Things a whole heap of people could have dead first night, same way, you know. So yeah, we give thanks and nobody not get hurt, and nothing great not really go on, but trees and things and people rooftop blow off.
And we take a break here on the Midday News, but stay with us. More news when we return. Welcome back, continuing the news. Stakeholders in Phase 2 of the Rural Economic Development Initiative, READY 2, are optimistic about the growth prospects with the project. READY 2 was officially launched Wednesday morning. The $42 million JSIF project is financed through a loan from the World Bank. Based on the successes of Phase 1, Managing Director of JSIF, Omar Sweeney, says he's proud of the progress.
I'm proud because based on the scale, $40 million, based on the geographic reference, which would be island-wide, we know that READY 2 will benefit more than 100 micro and small business enterprises.
The project will offer assistance to small farmers and attraction operators, including community tourism efforts. The sector ministers foresee great benefits going forward.
The reality is that agriculture and fisheries has to be the driver of our economic recovery program. We have to have a strong, robust, resilient agriculture sector. And the only way we can do that is if we're able to scale up our small farmers, scale up our fisher folk, and ensure that they're operating with cutting-edge technology.
The timing couldn't be more perfect. As at a glance, I see that tourism will play a big part in READY 2 in areas such as enhanced agriculture and tourism linkages, enhanced marketing of community tourism enterprises, diversified tourism offerings, allowing for expenditure and earnings within local communities.
The move by American Airlines to introduce pre-flight testing for passengers traveling to Jamaica, the Bahamas, and eventually the rest of CARICOM is being seen as a game changer that can provide a major boost to help revive the region's travel and tourism sector. Chairman of CARICOM and Prime Minister of St. Vincent and the Grenadines, Dr. Ralph Gonsalves, said he was pleased that American Airlines has taken the lead to initiate this pre-departure test program. Dr. Gonsalves said the Caribbean community welcomes this important progress to reopen markets, with the health and safety of citizens being of paramount importance. Proper first aid response could help save lives and reduce Jamaica's road fatality rates. That's the belief of the Jamaica Red Cross. It's why the entity is calling for more persons to get certified in first aid training.
There has been a slight reduction in road fatalities so far this year. Jamaica recorded 319 fatal collisions between January 1 and September 30. That is 12 fewer deaths when compared to the 331 recorded the same period last year. Some have attributed the reduction to the COVID-19 pandemic, but agree that 319 is still too high. Human Resource Manager at Jamaica Red Cross, Donna Thomas, says some of the deaths resulting from motor vehicle collisions could be prevented by simple adherence to road safety measures as well as some basic life skills such as first aid training.
First aid saves lives. Certainly more persons need to be trained so that when you have an incident on the road, for instance, or when there's an accident, more of us would know what to do.
While there are trained first responders island-wide, Superintendent in charge of Emergency Medical Services Gary Morgan says the fire department does not have enough personnel. Geographic location is another factor that may hinder their response to save lives.
Even if we should have firefighters trained or have an ambulance crew at all these fire stations, we might never have full coverage because an accident can happen anywhere, miles away from a fire station. So unless we're gonna put other contingencies in place, so by the time you get the call, leave from here, you go 20 minutes, half an hour away from a patient who has been in an accident, bleeding. That is a real challenge.
In many instances, images are circulated on social media platforms showing the regular citizen trying to render assistance. But the professionals warn that their good intentions could cause more harm than good.
Try to hold the person properly. So you grab the hand and the foot and you hold the person. It's wrong.
Norma Campbell is a senior trainer at the Jamaica Red Cross National Headquarters.
So first of all, when you go on an accident scene, you must check to see if the scene is safe. Look around to see if there's gas leak, fire, smoke, anything that will harm you. You must make sure that you are safe.
She adds that one should first identify themselves to the injured person, then put on protective gear such as a pair of latex gloves before touching them. A clean cloth or plastic can also be used. This is to prevent contact with any fluid that may be coming from the injured.
The next step is you go and you assess the situation or you assess the casualty. The first thing you're going to do, you're going to open the airway. And when you're opening the airway of a trauma casualty, because motor vehicle accident is classified as trauma, you do what is called a jaw thrust. That's another way of opening the airway.
Since the injuries may not be visible at first sight, it is important to secure areas such as the neck, back and feet of the victim. Then, when moving the victim, this is how it should be done. Prince Moore, TVJ News.
And that's it for the Midday News. Primetime News is at 7. Please join us then. On behalf of the entire team, I'm Herman Green. Good afternoon.